Hi, my name is William Gaspar. I'm a doctor, internal medicine, and we are here at the Gaspar Wellness Clinic, which also goes under the Beehive. We would like to talk about chronic uh, disease processes, their causes, and what are the things that we are missing when we work up a patient. So, when people talk about instances that they go to the doctor and then I have this problem, that problem, and they have a list of things. And then they say, well, the doctor checked my blood work and it did not show anything. So that's common because you can check blood count and kidney, liver, and all of those things look okay. Then comes the next round where they say, well, if we didn't find anything in your blood, and you still have these symptoms, then let's go and check uh, X-ray, chest X-ray, abdominal X-ray, whatever is needed, CT scan, MRI, and they'll do all those things to look for an anatomical issue. Are we having something that not easy to palpate, but we're gonna find it through a very accurate MRI? So we go through those protocols and workup, and you've seen the third doctor, and he says the same thing. We did not find anything. There's nothing wrong with you. Well, why am I hurting here? Why I don't have energy? How come I cannot sleep? How come I sleep 2 hours and I wake up and I cannot go back when I'm so sleepy and tired? And on and on. And I have a migraine. I go to the bathroom too many times and it's just liquidy, irritable bowel. What is going on? What's causing this? And a lot of times people start thinking, maybe I have cancer. It happened to me uh, when I got sick with a similar chronic fatigue fibromyalgia type of symptoms. And back then, 25 years ago, all the doctors were at the opinion that there's no such thing. It's a throwaway basket of conditions, and there's not like an exact uh, diagnosis that you can follow and find and treat. Well, by now we know it's not true, but still, you go to your doctor, and there's going to be those mysterious chronic illnesses that nobody finds a reason for, a cure for, because they don't know what they're dealing with. So let's look at some of the things. If you have something that is easily to be found, like you have anemia, your kidneys are failing, you're drinking too much, and your liver is bad, or you have high cholesterol and your liver is fatty, your heart is acting up. All of those things can be detected with pretty good accuracy. That's why doctors are there. And then they give you medication. You take your blood pressure medication, your heart medication, and you do better. So medicine is good in that regard. But when it comes to those mysterious chronic illnesses, I don't know why I feel like that nobody finds anything, and that's annoying. So what happens at those instances? I mean, you can say, well, I'm not eating as well as I should, and then definitely go eat a good balanced diet, more a Mediterranean type, eat more fresh vegetables and fruits, drink a lot of water, don't do the sodas and drinking alcohol and smoking and all of those things we know. I don't have to repeat it. But when you get to the point where, okay, I did that, now I'm eating like carrots for breakfast and all those kinds of things, and I'm drinking my celery juice, and it's nasty, but I'm gonna drink it every morning, then you have to say, okay, I'm doing my best, and still the mysterious chronic illness is there, walking around in our bodies. So at that point, what are the things that we're thinking? Uh, a lot of times a chronic viral illness is what is going to give you the answer. And the doctor will probably check your hepatitis panel, make sure that you have not picked up hepatitis from eating the wrong type of food or getting exposed, even sexually transmitted diseases, HIV, and all the other things we're thinking of. So we're thinking of some infectious agents, but one thing almost nobody thinks of, and that's the mystery. That's the Epstein-Barr virus. That monovirus that is causing us a sore throat in our younger ages or even older ages. I was maybe 40 years old when I got it the first time. It knocked me down bad. Then it went away. But 2 months later, I started having a lot of the aches and pains and not sleeping, no energy. It hurts here, it hurts there. What's going on with me? Why am I so sick? So that's annoying because you really don't tie things together. You might have had a viral infection, let's say 2 years ago, 5 years ago. And then you really don't connect it. Like, yeah, I had a bad sore throat. I don't even know what it was. I slept for 3 days. I drank the hot tea and whatever else I needed to do, gargled, and I'm good. And then 3 years later, you start having of aches and pains. And it's like, hey, what did I do? You start thinking back. Did I pull my back? Did I work out too hard? Uh, Maybe my shoes are not fitting well, or you go through a number of these things trying to figure out, trying to diagnose yourself because the doctors can't. They're just not able to, you know. And it's not part of our thinking because we diagnose things a lot of times that we can treat. Well, this one, as far as the regular medical protocol, we cannot treat. A lot of times you see people go to the doctor, and I have lupus or I have rheumatoid arthritis. Guess what? Most of those are caused by the Epstein-Barr virus. I challenge you to pick up your computer and just type in EBV, Epstein-Barr virus, and autoimmune diseases. And you will see what comes up. Rheumatoid uh, diseases, fibromyalgia, chronic fatigue, multiple sclerosis. I mean, there are actors and actresses who go on the news and say, I don't even leave my house because I have multiple sclerosis. I'm not going to say names, but if you watch the news in the last few years. And it blows my mind. Like, you got millions of dollars. You're a famous Hollywood star, and you don't know to go to a person who does functional medicine or does alternative treatments because your regular doctor is not able to uh, take care of it. They'll just give you things that help with the symptoms, but it's not adequate, especially when you start getting to the point where I cannot get out of bed. I'm only 52 years old. I'm a pretty actress. I cannot get out of bed. That's bad, you know. And so the suggestions that we have here at the clinic, I have my family working with us. Austin runs the clinic with my daughter Rubina. My wife is a master of herbology and iridology, and they all do some sort of protocolized approach to tell you, do your diet, check your blood, detoxify if you need to. So all of us are kind of training each other what we need to do to approach these problems. But the first thing is check your IgG, old antibody for the Epstein-Barr virus. Why the old antibody? Because if you check the one for mono, which is the new one, IgM, that is only positive for 2 months. So if you had a sore throat 6 months ago, 2 years ago, it's going to be negative. And a lot of times you go to the doctor, I think I had the mono, and can you check it? So the doctor goes ahead, checks the IgM antibodies. It comes back negative. No, you don't have the mono. Yes, you do. 90% of the adult population has it. Most people don't get sick from it other than the sore throat. which is great because it's their immune system. The immune system reacts a certain way, and then it causes the different diseases. Because people say, how come I had the mono and I have lupus from it? And my cousin had the mono, but she's going to have a rheumatoid arthritis from it. Or the other one will have something different in the group of autoimmune diseases. That's because our genetics. So this virus, by the constant irritation, turns on certain genes, and those genes, as they express themselves, will cause the specific symptoms. Which people say, yeah, I have a little bit of aches and pains. Guess what? Chronic low grade inflammation will cause your early aging. So, do you want to feel like at 50 you feel like you're 65, or you know no, you don't. So you have to be very careful that when you start having symptoms and you check your blood work and you find some of those things, your inflammatory mediators, ESR, C-reactive protein, CRP, a few others show that they elevated. This is the time to do something about it, because once you know throw a little bit of sugar crystals into your gas tank, what's going to happen? Yeah, my car is just a little bit like, but it still goes if I push the gas pedal enough. That's okay. But a few months or a few years down the road, you ruined it, and very hard to come back from that state. So you want to be proactive and go do the right thing. Check those things, make the lifestyle changes, make the dietary changes, take the supplements you have to, take good rests, not just exercise. Sometimes you just have to take a rest, and all the other things that will make your health better, which all of us know. We don't do it, but we know it. So our message to you from our clinic, and that's Austin, Rubina, and Eva, is that go to your uh, doctor, check those bloods, ask for the Epstein-Barr virus IgG old antibody. Sometimes they call it VGA or capsular antibody. So there has to be that. And what's going to happen is normal is below zero point 0.8. It can change from lab to lab, but let's say zero point 0.8 is the borderline. If you come back 8, that's 10 times the normal, and so you're positive, and you're probably positive for several years. So if you have the symptoms that we talked about, the myalgia, the migraines, the tiredness, the can't sleep, the irritable bowel, ringing of the ears, I mean, I can go on and on and on, because this mystery illness has a number of symptoms, and it's hard to pick it out, because once you have, let's say, uh, yeah, I have a lot of dizziness and this and this. You go to the doctors, they send you for an MRI, a CAT scan, and they spend thousands of dollars on you to say nothing is wrong with you. So I'm going to digress here a little bit. I had the chronic fatigue fibromyalgia 25 years ago. It started 8 weeks after I had the mono. I did not connect it. I started having all those symptoms, and I checked my blood. What's wrong with me? I didn't find anything. Then I started thinking, do I have cancer? Oh, well, I worked in hospitals where they have HIV clinics, and I double gloved and triple gloved, but who knows? So all of those things, almost thinking about it, make you even sicker. So at one point, I started saying, I cannot solve this. I'm going to go and talk to another doctor who will look at it objectively, and basically just see if something I'm not thinking of. So they checked my blood, nothing. They checked my back X-ray. Nothing. Can we do a CT scan on your back? Maybe that's gonna show it. Yeah, okay, CT my back. So they did. And then a radiologist was sort of a friend. We worked in the same hospital, so I could joke with him. So he's like, come here. Let me show you. There's nothing wrong with your back. Okay. I'm looking at the CT and the X-ray, and yeah, it looks normal. Um, I started thinking. I said, wait a minute. Do we have this a little bit off? We're thinking of uh, structure. We're trying to find uh, a back that is out of alignment, or a disc that is hanging out between the vertebrae. But if you don't find anything, how come you have pain? Well, it's because it's not a structural problem, it's a functional problem. And that's why you have to go to a functional medical doctor who will look for the cause of your problem, not do a CT or an X-ray and to prove that nothing's wrong with you. So when this doctor told me, look at the X-ray, look at the CT, it's all good. I started thinking. I said, let me ask you something. Don't take it wrong, but just let me ask you something. If I had a heart attack and if I die here, right in your office, and then you're like, okay, let's put him on the floor and then bring in the X-ray machine. Once you bring in the X-ray machine and then you do it, I asked the radiologist, would you think that um, it would look still normal? He says, yeah, you just died like 5 minutes ago, 10 minutes ago, you still look normal. So I said, do you see the irony here? You're telling this dead person that there's nothing wrong with his back. It's not, something's wrong with our medicine. I'm sorry. We have to start looking at disease processes more in a functional manner. What is causing it? And the common denominator here of all these autoimmune diseases, if you read up on it, is the Epstein-Barr virus, and one form or another. Sometimes the HHV4, sometimes HHV6, sometimes HHV8. But an even more sinister uh, problem with our youngsters. Guess what's causing some of the type 1 diabetes? A 4-year-old gets the Epstein-Barr virus, has a sore throat, it goes away. 6 months or a year later, the immune reaction destroyed the Langerhans cells or the beta cells that produce the insulin, or most of it, and then now you have a diabetic who's punished to take insulin for the rest of their life, hopefully 60, 70 years. But that's going to be a rocky road. So even you out there who have children at a young age, check the Epstein-Barr virus. Know it. I'm not claiming that if you go and figure out how to treat that Epstein-Barr virus, then the type 1 diabetes goes away. But I mean, if you have something in your system that bothers it, why not remove it? I mean, we do that with, anything that we get stuck with, we just pull it out, scratch it, make it go away. So you do the blood test, and after that, what can you do? There's no promise for cure. I got cured in 6 weeks. Every week on a Friday, I closed my office. I went to Lubbock to see a doctor who treated this with the Myers cocktail and high dose vitamin C. And that needs to be protocolized. You have to go to someone who knows what it means to be high dose. If you go to the local IV clinic where there's not a person who knows these things, then what's going to happen? You ask a nurse or paramedic who's giving you the IV, Like, are you putting in a lot of IV? Oh, yeah, a lot of IV vitamin C. How much? Oh, 5 grams. It's not enough. 10 grams, not enough. You need a little bit more. But that's not the point. There's a protocol how much you need, and there's a protocol how long you need it. And so I went and I did the protocol with the doctor in Lubbock 23 years ago, when finally a lot of my patients who were coming back to the office said, "Hey, doc, I know you have the chronic fatigue fibromyalgia, and you sent me to this doctor in Lubbock, and we got cured." I'm like, "No, you don't get cured of chronic fatigue fibromyalgia." "Oh, we got cured." So after about the sixth person, I'm like, "Okay, I'm going to go there." So that's what he told me. You take the Myers cocktail. So this Dr. Robert Myers, an MD, came up with this Myers cocktail in 1970, just a few years before they discovered the Epstein-Barr virus and was causing a lot of problems. So this doctor came up with the answers. Our government, God bless them, went to Africa to sidestep the whole process of putting things through the FDA. And they started using this high dose vitamin C in the Myers cocktail to see if they kill the virus. Will let's say a lymphoma, a B cell lymphoma, go away? But they started treating and curing B cell lymphomas. These articles are on the NIH site. I'm not trying to tell you things to um, confuse you, and I can't say that if you do the treatment, it's gonna 100% cure you, but there's a good chance that you get much better, and there are other things to do with it. And that's why you have to go to that specialist and know what you're gonna have to eat, know how you're gonna do detox, know how you're gonna even take your supplements, because you can just go and take some supplements. And do you know? I mean, I have a lot of supplements at home, and I don't know which one is the right one. So I need to talk to my wife or talk to someone who has good